Welcome. I'm Kathy Kliebert, the Secretary of the Department of Health and Hospitals. Thank you for joining us today. We're going to be talking about long-term supports and services. Many of you may know that I've spent the majority of my career working with individuals with developmental disabilities, individuals who are aging, and those who have adult onset disabilities. And I have worked very hard to assure that those individuals can receive the services they need in the most appropriate settings. I believe very strongly that a move to managed care is the next right step for us to take to ensure that those individuals and their families can receive high-quality services in the environment that they choose. What will follow is a presentation of about how I believe we can make this happen in Louisiana. Today's discussion will begin with an explanation of long-term supports and services, also known as LTSS. I will discuss what managed long-term supports and services, also known as MLTSS, are, and finally, I will go over our tentative timeline for moving LTSS in Louisiana to a managed care model. Our discussion today begins with an overview of what we mean when we refer to long-term supports and services, including an explanation of what those services are and how we currently provide them in Louisiana. Long-term supports and services refer to assistance given over a sustained period of time to people who are experiencing long-term inabilities or difficulties in functioning because of a disability. LTSS can be provided in facilities or institutional settings or through the home and community. Through Medicaid, the Office of Aging and Adult Services, OAAS, and the Office for Citizens with Developmental Disabilities, OCDD, DHH currently administers several programs that provide various specialized services for people with age-related or adult-onset disabilities or people with developmental disabilities who need long-term care. LTSS services have historically been largely institutionally based across both populations, but services are also provided to people living in their homes. During the last fiscal year, over $2 billion was spent to serve over 73,000 recipients of long-term supports and services in Louisiana. As previously mentioned, the department currently administers several programs that provide various specialized services for people with age-related or adult-onset disabilities or people with developmental disabilities who need long-term care through Medicaid, and two of our program offices, the Office of Aging and Adult Services and the Office for Citizens with Developmental Disabilities. OAS serves persons with age-related or adult-onset disabilities occurring after age 22. Some programs are cross-disability and serve persons with developmental disabilities and/or behavioral health needs as well. OAS provides direct management and/or programmatic expertise for over $1 billion in Medicaid spending on community and facility-based LTSS for this population. OCDD serves children from birth through age 3 in early intervention services and persons age 3 through end of life with intellectual and developmental disabilities. OCDD provides direct management and/or programmatic expertise for about $900 million in Medicaid spending on community and facility-based LTSS for this population. In the Office of Aging and Adult Services, we have several programs and waivers that are part of our long-term supports and services system. There's the Community Choices Waiver, which offers services such as personal care, support coordination, home modifications, meals, and skilled maintenance therapy. The Adult Day Health Care Waiver, which provides health and social services in a center-based setting for all or part of a day. We have our state plan services, the long-term personal care services that provide help with activities of daily living for persons who qualify for assistance under the program guidelines. And we have the PACE program, which is the program of all-inclusive care for the elderly. It covers all acute and long-term services for participants. And then nursing facilities. They conduct level of care and pass or level 1 screenings for all nursing home admissions to certified facilities. On this slide, you will see programs and waivers offered through the Office for Citizens with Developmental Disabilities. The New Opportunities Waiver, which offers people aged 3 and older a comprehensive menu of services designed to support persons with all ranges of need. The Residential Options Waiver offers people of all ages services designed to support them to move from intermediate care facilities and nursing facilities to community-based settings and to serve as an alternative to institutionalization. The Supports Waiver offers focused, individualized vocational services to people age 18 and older. The Children's Choice Waiver offers supplemental support to children through age 18 who currently live at home with their families or with a foster family. Early intervention services through Early Steps provide services to families with infants and toddlers aged birth to 3 years, 36 months, who have a medical condition likely to result in a developmental delay or who have developmental delays. Other programs offered in OCDD are home and community-based services regional programs. These include flexible family funds, which provide monthly stipends to families of eligible children with severe or profound developmental disabilities from birth to age 18 to help their families meet extraordinary cost. Individual and family support provides assistance for persons to live in their own homes or with their families in their own community. And resource centers are designed to build capacity of community providers. Additional home and community-based programs that are provided by Office of Aging and Adult Services and Office for Citizens with Developmental Disabilities are Money Follows the Person Rebalancing Program, My Place Louisiana, and Permanent Supportive Housing. Intermediate care facilities for persons with developmental disabilities are facility-based, comprehensive, and individualized health care and rehabilitation services to promote functional status and independence. Now I'd like to explain what it means when we refer to managed long-term supports and services. According to the Centers for Medicare and Medicaid Services, managed long-term supports and services refers to the delivery of long-term supports and services, which includes both home and community-based services and institutionally based services, through capitated Medicaid managed care programs. These programs can be operated by a variety of health plans, including managed care organizations. There has been a growing movement in this direction across the nation, from 8 states in 2004 to 15 in 2013 that have managed long-term supports and services programs. The key objectives of restructuring long-term supports and services to a system of managed care are to 1. Improve quality of services and health outcomes, 2. Decrease fragmentation and improve coordination of care, 3. Create a system that utilizes proven and/or promising practices, 4. Refocus the system in order to increase choice and provide more robust living options for those who need long-term supports and services and their families, and 5, rebalance the system in order to meet the growing demand for services within the existing level of expenditures for the long-term supports and services population. Louisiana's approach will incorporate the 10 key principles identified by CMS in May 2013 guidance as being inherent in strong managed long-term supports and services programs. The principles are adequate planning and transition strategies, stakeholder engagement, enhanced provision of home and community-based services, alignment of payment structures with managed long-term supports and services programmatic goals, support for Medicaid beneficiaries, person-centered processes, comprehensive and integrated service package, qualified providers, participant protections, and quality. On August 30th, the Louisiana Department of Health and Hospitals, DHH, released a concept paper on the transformation of Louisiana's long-term care supports and services system. In the concept paper, DHH explains that a comprehensive managed long-term supports and services program can improve the quality of life for many of our state's most vulnerable citizens. DHH has assembled an advisory group of stakeholders to guide the process towards managed care. The advisory group first met on October 3, 2013, and has met 3 times since then, with the latest meeting on February 6, 2014. Additionally, the department has been working with the advisory group to incorporate public feedback through webinars and various public forums. The advisory group has met over the last few months to discuss the specific areas of feedback requested in the concept paper we released in August. These topics include accountability, consumer protections, measuring quality and outcomes, stakeholder engagement and communications, enrollment, benefit design, care coordination, populations, focus on rebalancing, providers, choosing our partners, and implementation. Some of the questions discussed during the advisory group meetings under those areas of feedback requested include: under consumer protections, aside from the initial and annual enrollment periods, what factors should warrant an individual being able to change plans? Under measuring quality and outcomes, what do you believe are the most critical domains to measure in assessing the outcomes of a managed long-term supports and services system? Under benefit design, should benefits be all-inclusive, i.e. inclusive of medical care, pharmacy, and behavioral health care, as well as long-term supports and services? Under enrollment, given the department's position that enrollment must be mandatory in order for managed long-term supports and services to achieve desired outcomes, what protections and assistance should be provided to help with the enrollment process? And under providers, how can the state make sure that providers are sufficiently prepared for participation in managed long-term supports and services? What requirements should be placed upon MCOs in this regard? DHH has already incorporated feedback from the advisory group in the following ways: the decision to pursue dual RFPs for the two populations, one for developmental disabilities and one for aging and adult onset disabilities, with one population phasing in after the other. Allowing waiver recipients to voluntarily opt-in, opt-out of Bayou Health prior to managed long-term supports and services implementation, and holding both webinars and public forum meetings around the state to allow public feedback, including day and nighttime meetings. Now I'd like to share our tentative timeline for moving long-term supports and services to a managed care model. Advisory group meetings and public feedback, our time frame for that is October 2013 through June 2014. Our anticipated RFP release, summer 2014. Our deadline for proposals, 60 days from the RFP release. Evaluation of proposals, 30 days from the day following that deadline. Announcement of contract awards, to be determined following the evaluation period. And assignment of members to health plans and notices sent. First day of the month prior to the month managed long-term services will go live, and the go-live date will be determined in the future. This concludes the presentation component of our meeting today. All of my contact information is listed on this slide if you need to reach us after the presentation. We continually update our website for managed long-term supports and services, which can be found at www.makingmedicaidbetter.com/long-term care.